What if your body could warn you weeks before a stroke? Most people miss the signs, and sometimes it's a matter of life or death. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. And that's exactly what we do here at UB Health. Today, we're talking about the subtle clues your body might send out up to a month before a stroke. They're often easy to ignore or chalk up to stress or being tired, but recognizing them early can make all the difference. Let's start with one of the most common and misunderstood early warning signs: excessive fatigue. I once had a patient, mid-40s, healthy looking, no major issues, but she came in because she just couldn't shake this weird, overwhelming exhaustion. She thought maybe it was burnout. A few scans and blood tests later, we saw signs of a recent transient ischemic attack, also known as a mini stroke. Her fatigue wasn't just fatigue. It was her brain signaling something more dangerous. Fatigue that doesn't go away with rest and isn't explained by obvious causes like lack of sleep or illness can be an early stroke symptom. It could stem from narrowed arteries in the brain slowing down oxygen flow. If you're feeling off in this way, trust your gut and check in with a doctor. Next, let's talk vision. Blurry sight, double vision, trouble focusing. These kinds of issues are often blamed on eye strain or aging, but when they come on suddenly, they can point to a blockage in the blood vessels feeding your brain, another early warning for a type of stroke called ischemic stroke. And then there's the thunderclap headache. If you ever experience a sudden, severe headache described as the worst one of your life, don't wait. Go to the ER. This kind of pain can signal a ruptured aneurysm or a hemorrhagic stroke, which involves bleeding in the brain. It's a red flag not to be ignored. Another often overlooked warning sign is numbness or weakness, especially on just one side of the body. It might be in your face, arm, or leg. I like to remind folks that even a temporary episode, like a few minutes of numbness that resolves on its own, could be a transient ischemic attack, your body's advanced alarm system telling you a full-blown stroke might be next. Speech difficulties are also powerful indicators. Slurred words, being unable to get thoughts out, or struggling to understand others, these aren't just signs of being tired or confused. They can point to serious neurological changes happening in real time. Let's also not forget about balance problems. If you suddenly feel dizzy, lose coordination, or can't walk in a straight line, especially in combination with a headache or numbness, don't brush it off. These neurological symptoms can precede a cerebral event. Now, what about prevention? The good news is you have more control than you might think. Managing high blood pressure is the #1 way to reduce your risk. That means taking prescribed medication if needed, eating healthy, limiting salt and saturated fats, exercising regularly, even just 30 minutes a day, and not smoking. If you have a family history of stroke or brain aneurysm, talk to your doctor about getting screened. There are tests like CT angiograms or Mr. Angiography that can help detect problems before any symptoms arise. Simple at-home tips? Eat more leafy greens and whole grains, hydrate well, and cut down on alcohol. And don't ignore snoring. Severe sleep apnea has been linked to increased stroke risk. If you're waking up tired, even after a full night's sleep, it's time to look deeper. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from UB Health. Stay informed, stay proactive, and I'll see you in the next video.